you can travel for your healthcare and receive treatment for things like knee and hip replacements and a whole rake of other things, which we'll talk about, while still remaining in the public system. I'm joined this morning by Paul Byrne from Healthcare Abroad and Jackie Gallagher, who has been through the process. Good morning, both. How are you?
Morning.
Good morning, Kathryn. Thanks for having me on.
Come here, Paul. I know that you were meant to be with us, but you have had to jet off to sunny Spain. We're sitting here feeling very sorry for you, Paul, all of us. But listen, you are, your company is called Healthcare Abroad, so it would make sense that you have to go to Spain, which I know is where a lot of your hospitals are. So tell us about, let's just start at the beginning. Tell us firstly about Healthcare Abroad and what you actually do.
Yes, thank you. And yes, I spent away there to come to sunny Spain away from the high winds and rain. So Healthcare Abroad is a private company, and what we generally do is we sit between the patient, the HSE and the 87 private hospitals that we represent across Europe. Now, the majority of our hospitals are in Spain, and the reason behind that is Spain is number 3 as a healthcare system in Europe and 7 in the world. So you are going to a top class, 5-star healthcare hospital system. So that's one of the reasons. The other reason is, Spain is not really that much of a foreign country for people. We have Irish people have a good affinity with it. It's only a 2.5-hour flight, and also the cost of living is a bit cheaper, and that sort of helps in relation to the patient, because one part of the scheme, one of the rules and regulations with the scheme from the HSE is they do not refund your travel costs.
And does that mean flights and accommodation?
Yeah, flights and accommodation. But what we do is we have hubs on the ground here in Spain. So for every hospital we have a hub, which means we have drivers and carers on the ground here. They will meet the patient. We actually meet them if they fly out of Cork, Kerry, Dublin, Shannon, Knock. We have a representative that will meet them there before they fly out. And then when they arrive here in Spain, we will pick them up at the airport. We'll do all the logistics for them. So we'll bring them to the hotel. We partnered up with hotels close to our hospitals. And again, the reason why we do that, because we're bringing between 30 to 40 patients per week at the moment, we get a really good preferential rate from the hotels. They're €90 per night for 2 people in a 4-star hotel, including breakfast. So, for an orthopedic surgery, for a hip replacement or a knee replacement, you will be in Spain for 2 weeks, but you're looking at anything between €1,200 to €1,500 for flights and accommodation and breakfast for those 2 weeks. So it's not that, we keep that cost down as best we can.
Okay, I would have remembered the bus that would have taken the cataract patients up north, right? And you'd get up and you'd be up and down in the day, and this was pre-Brexit, obviously. I didn't really understand. So this is the EU cross-border directive, and this is for it can be for hip replacements, knee construction, bunion surgery, varicose veins, and so many other surgeries. So Jackie, you're in studio with me, and we'll come to you about your surgery in a bit, but tell me where you're from and your injury and what happened to you.
I'm actually from Finglas.
Very good.
I had a fall about 10 years ago. I landed on my 2 knees on the kitchen floor, literally walking in the back door.
God.
And I'd actually fractured my right kneecap, but I'd done my damage to my left knee. Now this was ongoing for a few years. Then I actually joined Slim World and lost the weight, which relieved the pressure off my knees. So then last year I was in work and I felt something going in my knee. I went to my GP, was out for a couple of weeks, went back to work, and then I was out again from literally last April.
Okay.
So I did go to Belfast for a minor surgery.
And how come you didn't get the surgery done here?
Waiting lists.
Right.
I was actually on a waiting list, and I had got an MRI done and sent it in to the hospitals here. And I was told I could be waiting up to a year and a half to even see a consultant.
Wow.
So then I got in contact with, I was actually at the ringing up the HSE myself. And then when I came back, I just wanted to find out if I went abroad, would I get the...
Would it be covered?
Would it be covered?
Yeah, of course.
So when I got off the phone, they said, yeah. So when I got off the phone, I'd seen the little icon for the Healthcare Abroad scheme. And I rang them on the 11th of September and explained everything, what was going on, what was entailed, all the to do with credit union loans and all. I was out of work from April, so I was literally on pension rate from work. So whatever savings I had was literally diminished rapidly.
God.
But they got in contact with the credit union here and got credit union loan. And as I say, I rang them on the 11th of September and I was in Denny and Alicante on the 8th of October.
And can I ask you, were you nervous about going abroad to get surgery?
I was at the start, but like when I got over there, it was just the care, attention that you got was just exceptional. You know, like when I actually clicked into the icon for the healthcare abroad, you know, the way the reviews and Trustpilot and all that, and I was reading all the reviews and I actually laugh when I think of it now. Like I'd say these are all being paid to say these things. They're so good, you know, the reports, the reviews were just amazing. Like, and I got in contact with a lady through Facebook that was over there, and I'm still in contact with her now.
Right. And from the moment that you went on and you clicked onto the icon on healthcare to the moment that you had your surgery, how long was that process, considering you were a year on a waiting list?
As I say, I rang healthcare on the 11th of September and I was in Alicante on the 8th of October.
Amazing.
Like literally less than 4 weeks, you know, and that was everything. Like to get your MRIs here, you had to get bloods here and whatever, and that's all sent over. Then with the credit union, you get your loan from the credit union, they send it over to Spain. Then, literally the 8th of October I was over there.
And how are you doing now?
Great. Absolutely amazing.
Are you back doing your Zumba classes?
Doing my Zumba classes.
Because I know you love them.
Yeah, absolutely, yeah. Love it.
So it's like just getting your life back again.
Absolutely, yeah, and getting back to work.
Yeah.
People think that, you know, getting back to work, you say you don't want to get back to work, but I need it. And also I volunteer for blood bikes as well, Blood Bikes East. So I wanted to get back to doing things that I love, like.
Okay. Paul, I'm going to bring you back in here. I mean, obviously it worked wonders for Jackie, and we all know about the waiting lists in this country. In terms of just talking us through the payment system and how that works, how do you, in terms of how somebody gets set up to be reimbursed, do you have to pay out before you go, or is this all done in retrospect?
So, generally what we do, we try and do everything for the patient. There are a couple of things we can't do. I would always say to a patient, you know, you have to book your flights. That's the first thing. And secondly, you have to have the funds in place to pay the hospital when you arrive in Spain. The patient will pay the hospital directly, and then the HSE will refund directly to the patient. Or I'd say 90% of our patients would use the credit union, and I must give huge kudos to them as well, because without their support, a lot of patients, including Jackie there, wouldn't actually have the funds or be able to utilise this scheme. The patient has to apply for the loan, but we do send in support documents to the credit unions to make it easier for them. The credit union can transfer the funds directly to the hospital, and then what happens, the HSE will refund directly into the credit union. Again, no third parties have access to funds. No funds ever come through us at any part. So the funds will go straight back in and clear the loan to the credit union. It does take the HSE approximately 16 weeks to make that refund, or 4 months. So that's how long you'll be waiting for your payment. We engage with the GP. It starts there with a referral letter. So when the patient arrives, as I said, we pick them up, we organise everything in the hospital for them. And the good thing, and again about Spain, because it's orthopaedic, the aftercare, you do your physio in the hospital when you're on the second week in Spain. So your first week is about your surgery, second week is about your physiotherapy and your recovery. When you fly home, then we gather and collate all the documentation for the HSE, so they don't have to do any of that. You, the patient, must pay for the surgery yourself. It has to come from an account in your name. You pay the hospital directly, and the HSE will refund directly to them.
And do you have an absolute guarantee that refund will happen before the surgery happens?
Yeah, because we don't. It's not pre-approved from the HSE, but we guarantee it. Again, because we're doing this for between 35, 40 patients per week. There's over 35 of us in the company working at the moment, so we all have a job to do, or a link in the chain. So we know exactly how and what way the HSE require that paperwork. So we guarantee it for them, because we don't make the mistakes.
Yeah. All right. Well, listen. Glad that you're back on your feet again, Jackie, and swinging around the Zumba dance floor. So long may that continue. Yeah. Paul, lovely to chat to you this morning from Healthcare Abroad. What's the website that people can have a look, Paul?
Healthcareabroad.ie. And once again, Kathryn, thanks a million for having us on. I really appreciate it, and hopefully we can help some more people out there.
Not at all. Thanks for talking to us this morning. That is Jackie and Paul. Let's get some more music now.